So today we're going to have a food insecurity presentation from Madison Cahill, Corrales Rodriguez, Morales, and Tamsin Smith. And I'm now going to turn it over to them.
All right. So we're going to start with a broad overview and just a general idea of what is food insecurity and how we measure it. So food insecurity, as defined by Feeding America, is a household's inability to provide enough food for each person to live an active, healthy life. There's different levels of that, and they go from very low to a high food insecurity. So this is different than hunger. Hunger is a personal, acute feeling of like not having enough to eat. Food insecurity is what happens when you experience hunger over a longer period of time. And there's also a lot of different things that go into that. In the studies that we are focusing on today, with a measured food insecurity was by a 2-question validation system. So if a family during the survey answered yes to these 2 statements, the food we bought just didn't last and we didn't have enough money to buy more. And the children in my household were not eating enough because we just couldn't afford enough food, then they were marked as being food insecure. Next slide, please. Thank you. And then what does this matter in even a more general idea? So food insecurity is often very closely tied to nutrition. And getting an adequate nutrition is obviously very important, we all know. So what is malnutrition? It is experiencing deficiencies, excesses, or imbalances in a person's intake of energy and or nutrients. So this can take a lot of different forms. You could not be getting enough calories, you could also not be getting enough of a specific kind of macronutrient, your carbs or proteins. You could also be getting not enough of a specific vitamin or mineral, and that's a micronutrient deficiency. And these all manifest in very different ways, but all across the board, if you are not getting enough of your energy and micronutrient needs, then you are malnourished and it is going to affect your health negatively. So we just say, without good nutrition, good health is not possible. Next slide.
And so I wanted to take a look at some briefs by Feeding America, who looked at unemployment values for predicting how the coronavirus could affect food insecurity across the nation. And just for some situational awareness, I do want to report that the Bureau of Labor Statistics recently said that between February to now, we've had an increase of 6.7% to our unemployment rates. So that's just something to keep in mind. And the first brief I want to talk to you about is called The Impacts of Coronavirus on Food Insecurity. And that was released on March 30th and revised on April 22nd of this year. And one of the most important things that I thought was mentioned in this study was that those in the service occupation are the most impacted by food insecurity at about 16 to 17% of that workforce. And then the transportation, material, and moving occupation had about the same level of food insecurity as service. And when looking by industry, the hospitality and leisure industry is the most affected by food insecurity at about 16% of its workers experiencing food insecurity. And this is important because these workers are particularly vulnerable to shutdowns, with many being laid off during shutdowns. And as we look at the table at the bottom, scenario A represents the increase in unemployment rate we saw in the first year of the Great Recession. Scenario B represents the increase in unemployment rate in the first 2 years of the Great Recession. And then scenario C is a more extreme scenario with an unemployment rate increase of 7.6% and a poverty rate increase of 4.8%. And that's the one that we are currently closest to right now. And if scenario C ends up being a true prediction, then we can expect to see about 17.1 million additional Americans experiencing food insecurity because of this pandemic. Next slide. And I also wanted to look at child food insecurity. And one thing to note is that households with children are more likely to be food insecure, and this is even before you put the pandemic into perspective. And households that are more likely to experience food insecurity are those that have minorities, are headed by single parents, especially if that parent ends up being a female, and households where either the parent or the child has a disability. And again, focusing on scenario C because that's the one we're closest to, it predicts that 1 in 4 children across the nation will experience food insecurity because of this pandemic. Next slide. And then the last brief looks at local food insecurity, and it's trying to predict how the local level is going to be affected by this pandemic. And when looking at state by state, there is a huge range for child food insecurity, with our lowest being Massachusetts at about a predicted value of 18.4, and then the highest being Louisiana at 34.5% of children experiencing food insecurity. And one of the 3 trends that the study noted when looking at food insecurity was that areas that had higher rates of food insecurity pre-pandemic were going to continue to have higher rates of food insecurity during and post-pandemic. Areas that had a large amount of individuals who are food insecure, think your high density populations like cities, those were going to continue to have large amounts of individuals who were food insecure during and post-pandemic. And then the areas that were going to experience the most increase in food security were going to be your areas of low food insecure rates pre-pandemic. Though it is important to note that these areas are still probably going to have lower rates of food insecurity when compared to your higher rate districts. Next slide. And this is just to see how that plays out across the nation, just for some situational awareness. As you can see, Georgia is in that nice salmon color, which means we're about middle of the pack as far as overall food insecurity rates go. Not that that's good, that's still at about a 16 to 17%, but this is just a figure to give you some situational awareness. Next slide. And I also wanted to look at child food insecurity. One of the most important things to note is that only 3 states are at the lightest color, and that's representing less than a 21% food insecurity rate for children, which is still about 1 in 5. So, and only 3 states have that minimum color. Again, Georgia's in the middle of the pack at about 24 to 26, so about 1 in 4 of our children will experience food insecurity. Next slide. And then just to give you a look at what Georgia is currently facing, our predicted rates of overall food insecurity are shown at the top, and then the increase in food insecurity is shown at the bottom. So our top 5 counties that show food and high overall food insecurity rates are Clay County, Randolph County, Terrell County, Crisp County, and Candler County. And for high food insecurity rates for children, the maps are roughly the same, which is why I only show the overall maps. And a lot of the counties are the same. So the top 5 counties for children are Clay, Randolph, and Terrell again as the top 3. And then you have Quitman and Tolliver tied at 48% at 4 and 5. And then the counties experiencing the most increase are Forsyth, Fayette, Oconee, Cherokee, and Gwinnett. And then those that have the most increase for children food insecurity rates are Forsyth, Fayette, Cherokee, Gwinnett, and Cobb County. And I did put the link at the bottom here for you guys to look more at the map, as it shows a lot of data for states, counties, and congressional districts. Next slide.
So now I'll be talking a little bit about the global impacts the pandemic has had on food insecurity. Prior to the start of the COVID-19 pandemic, more than 820 million people faced chronic food insecurity. This means that 820 million people have persistently been unable to meet their minimum food consumption requirements for a long period of time. Additionally, 135 million people were facing acute food insecurity, which is defined as a short situation due to conflict or natural disasters. This is all according to the United Nations World Food Program. A few of the reasons for the increase in food insecure individuals due to COVID-19 are children missing out on daily school meals, which provide the necessary nutrients. There's also an increased number of people being pushed into extreme poverty due to a loss of income and the economic fallout the pandemic is causing. There's also limited availability and limited affordability of food, and in many countries, the interruption of nutrition and feeding programs due to lockdowns. Next slide, please. This pandemic also came during a time where many countries were already factors that threaten their food security. Some of these factors include armed conflicts, natural disasters, climate change, and the arrival of pests such as the desert locust, which have already caused damages to crops in many countries. And it is believed to be the worst locust invasion in over 70 years. A lot of countries have put in place quarantine orders, border closures, and export restrictions due to COVID-19, which have disrupted trade, have created labor shortages, and in time, it has negatively impacted food security in countries that rely heavily on the import of food. Next slide, please. Disruption to supply chains worldwide due to COVID-19 and the increase in demand for food have increased food prices across the world. Price increases have worsened the severity of food insecurity in developing countries where people already spend a major part of their income in food. In the US alone, they saw the sharpest increase in prices of grocery items in 50 years during the month of April. And it's expected that meat prices could increase by 20%, but meat supplies could actually shrink by 30%. And this is all according to the US Global Leadership Coalition, who released a brief on COVID impacts on food insecurity during the month of June. Next slide. Now, let's come back to the US and take a look at how the pandemic has affected food security among children in the US during the month of June. So the US Census Bureau asked about food insecurity in their household pulse survey. And the graph that you're seeing right now breaks down the percentage of households with children that reported food insecurity by race. Brookings, which is the place that published the results of the survey, they reported that during the month of June, around 16% of households with children who filled out the survey reported that their children were not eating enough over the previous week due to a lack of resources. This translates to 14 million children in the US who were not getting enough to eat. The overall rate is the highest on record. But as you can see in this graph, Black and Hispanic children are experiencing food insecurity at even higher rates when compared to all households. Brookings reported that about 3 in 10 Black households with children and 1 in 4 Hispanic households with children did not have sufficient food to eat due to a lack of resources in June 2020 alone. Next slide. In the survey, households with food insecurity reported various reasons for not working. 23% said that they had lost their job or were temporarily out of work due to the pandemic. 13% said they were not working because they had to take care of children who were not at school or no longer in childcare, or they were caring for someone who contracted COVID-19. 8% said that they had contracted COVID-19 themselves, but 48% of the respondents said that they were working, but their earnings were not enough to meet basic needs, which contributed to having a household with a food insecure child. Out of everyone who reported that their children did not have enough food, 78% reported a household level loss of income since the pandemic began. Next slide.
And so we've been talking a lot about food insecurity, and now I want to go over why that matters. As Tamsin said, a lack of nutrition can lead to a host of problems within your body. And when you are low on money, you're probably going to go towards the most cost-effective food, which is going to end up being your processed food with a bunch of added sugars and other additives that are not necessarily the best for you nutrition-wise. And so one of the things that this can affect is mental health. Increased sugar intake causes higher levels of common mood disorders, these such as anxiety and bipolar disorder, and it can lead to higher rates of depression, as seen in a Nature article that I've referenced on our reference slide further in the PowerPoint. Poor nutrition can also lead to a lot of chronic diseases, one of them being obesity. And there was a study done to look at how food insecure individuals are actually at a greater risk of obesity, called the hunger obesity paradox. And one study looked at food insecurity at age 1 led to obesity at age 4. And obesity is a risk factor for a lot of other acute and chronic diseases, such as diabetes, coronary heart disease, some types of cancer, depression, and COVID-19. Other nutrition-linked diseases are type 2 diabetes, hypertension, and cardiovascular disease. Next slide, please. Another thing nutrition is critical for is brain development. If children do not have good nutrition natally or early in life, it could severely cripple their brain development and lead to cognitive and motor defects that, if it happens early enough in life, could be irreversible. And this is taken straight from the Urban Child Institute website, also linked in our resources. And it says that a recent study finds that compared to their peers in food-secure families, food-insecure children at age 3 are 90% more likely to have fair or poor health rather than good or excellent health, 31% more likely to spend time in the hospital, and 76% more likely to have problems in cognitive, language, and behavioral development. And so this all matters because food insecurity can lead to decreased mental health at a time where, as a nation, we are experiencing the lowest mental health that we've had in a while. It can lead to decreased in learning and participation in schools at a time where we are constructing new learning environments, either in our classrooms or remotely, to handle the pandemic. And it can lead to an increased burden in our healthcare system in future years because we will need increased personnel, money, and resources and supplies to handle all of these complex nutrition-related diseases that can arise from large levels of food insecurity for sustained times. Next slide, please.
Now, I'll be explaining a little bit how water ties into the COVID-19 pandemic. In many communities around the world, a lack of a water supply and sanitation is depriving people of their most basic protection against the spread of the virus, and that's hand washing. 2.2 billion people around the world do not have safe drinking water. 4.2 billion people do not have safe sanitation services, and 3 billion lack basic hand washing facilities. And this is all according to the UNICEF and the World Health Organization. And this was a pre-pandemic report that was developed by them during the year of 2019. Drought, extreme weather, and flooding are other significant problems that have been threatening water security and long-term recovery efforts. And these long-term recovery efforts are programs that are dedicated to providing safe water and sanitation facilities to communities that do not have these facilities. And these efforts are also being affected by the pandemic due to lockdowns and travel restrictions. According to the World Health Organization, If we improve sanitation, water, and hygiene, we can potentially prevent at least 9.1% of the global disease burden. And this is not just COVID-19, but other diseases that are waterborne and others that can be prevented by increased hand washing. Next slide, please.
We just heard a lot about the problems of food insecurity and how it is affecting everybody in the world. And I just wanted to highlight some organizations that are trying to reduce food insecurity. So these are specific to Atlanta, but it is not an exhaustive list. And there are also similar organizations doing work in other areas of the state and country. So there's Atlanta Community Food Bank. It serves thousands of people a week, and it provides food to partner agencies who actually are preparing and then distribute the food directly to low-income Georgians. Second Helpings Atlanta works similarly in that it is kind of linking food donations with partner agencies who already have the capacity to provide and distribute this food. Atlanta Family Meal is a really cool organization that has sprung up around COVID, and it is targeting a population that is severely in need of help right now, and it is the restaurant and hospitality industry. So it takes restaurant workers and they prepare meals for other restaurant workers who are right now out of work. Another population that needs targeting is seniors. So the Metro Atlanta Senior Hunger Coalition has a lot of programs around getting food and increasing access to food for seniors. Foodpantries.org will just give you a list of food pantries in your area. You just have to plug in your area code. And then there's a lot of urban gardens and food rescue organizations, especially around Atlanta. So I just want to highlight one of them, Concrete Jungle. So they do a lot of urban gardening. They also have a fruit tree map, and they have some COVID-specific programs like a grocery delivery service in these times. Next slide, please. Thank you. So if you are interested in learning more about food insecurity and the systemic effects of it, there's a few different options for you. We have some books. We recommend The Good Food Revolution, Growing Healthy Food, People, and Communities. There's also some audio options if that is something that you prefer. The College Hunger Campus Listening Sessions. Also 2 podcasts, The Secret Ingredient and the Just Food podcast. Next slide. Thank you. Specific to Georgia, if you want to learn how to maybe increase your food security or share a resource with somebody else, there's the UGA Extension. So this will give you a lot of different options for making your own food and doing it cheaply and in a more sustainable way. So you can learn how to grow your own food, cook your own food, and then preserve your own food. And if you do all of that together, you can save some money and also, prevent waste and all of those things. They also teach classes on nutrition, leading an active lifestyle, and SNAP education if that is something that you need. So you can find these all under the Food and Health tab, and you can also look at the UGA Extensions calendar. They are holding webinars regularly. Next. Through our research, we came up with a few recommendations based on the organizations that we were looking in, the sources. So some things that we are hoping and looking for in the coming months are an increase in the maximum SNAP benefits by at least 15%. And this is at least 15%. So more would, of course, be better. Some people recommend like a 22%. We should also double the minimum SNAP benefit as well. So definitely looking into expanding this program. We should also expand the PEBT. So this is a fund that is providing students who are not able to get in-school lunches with basically a supplement or a substitute for that. And it is recommended that this is extended through the summer of 2020 as we're wrapping that up and through the 2021 school year. this is really important because, you know, some schools are in person right now, some are not, and things are kind of up in the air. So it would be good to have this program as a fallback to make sure that our kids are not going hungry. And then finally, we just recommend that, you know, the governors are working closely with USDA, and they're looking at ways to provide economic stimulus and protect the food security of their constituents. Next. Here's a list of our references. And we have links and names of the sources if you're interested. And yes, thank you very much. We enjoyed researching this and sharing this with you.
So I would like to thank Dana Kraft for sharing a lot of the reference material you just heard from Feeding America. And with that, I would like to turn it over to Dana Kraft with the Atlanta Community Food Bank. Dana?
Thank you. And I'm Dana Kraft with the Georgia Food Bank Association, which is comprised of the Atlanta Community Food Bank and 6 other regional food banks that are all part of the Feeding America network. First of all, I want to thank Madison, Corrales, and Tamsin for a wonderful presentation, very thorough and well-researched. And I really appreciate the work that went into it and the very professional presentation that they have just done. As Vanessa mentioned, pre-COVID, the Georgia's regional food banks were serving about 156,500 individuals, unique individuals every week. The food insecurity stats pre-COVID, 1 in 5 children in Georgia were living in food insecure households, and 1 in 7 Georgians were food insecure. The food banks traditionally serve this population through a network of community-based partners. 74% of those agencies, and there are more than 2,000 of them that we're operating, are faith-based organizations, congregations mostly run by seniors and volunteers. And when COVID happened, we saw an immediate statewide increase of about 42% increase in food insecurity. And unfortunately, children are most impacted by it because of school closures and the number of children who rely on free and reduced price lunch. We continue, the food banks in Georgia continue to respond to a sustained, unprecedented 40% increase in demand. And 30% of the clients are reporting that they are seeking help for the first time. They are newly jobless and needing supplemental food to help them. So we are responding to that increase with the help of about 160 members of the National Guard. And we're so grateful to Governor Kemp for deploying those missions to the food banks because in the middle and southern part of the state, in the rural communities where those faith-based pantries were operating, a lot of them have suspended operations because the seniors are protecting themselves, appropriately sheltering at home. And so the National Guard have helped us pre-bag and pre-box food that is distributed at those big sort of mobile pantries that you normally see where people drive through with their trunks open. So the food banks really have taken on additional roles in moving food into areas where the agencies have been suspended. We have done that thanks to the USDA foods that are being made available to the food banks. On a regular basis, they distribute TFAP, Temporary Emergency Food Assistance Program commodities. These are high quality, very nutritious commodities. The food banks have also been distributing trade mitigation commodities, crops that were unfairly targeted for retaliatory tariffs by China. And the table-ready crops are being distributed by the food bank network. And they've been distributing about 40% of the CFAP farm to family boxes. And all of that food has been critically important to our ability to respond to this increased need, especially in rural communities where USDA comprises more than 50% of food bank inventory because they simply don't have a whole lot of other grocery stores or food manufacturers located in their territories. The workhorses for responding to food insecurity are USDA programs like SNAP, and the National School Lunch Program and summer meals. All of those are absolutely critical right now, and we are advocating for a temporary increase in SNAP. And we know that the lunchroom ladies, the school food authorities, the nutrition directors at the schools are just, they're heroes. They are just doing tremendous work to try to make sure that kids in remote learning situations have access to the lunch meal, but there are still too many kids that are missing that meal. We are very worried about child food insecurity in the state right now, and looking to advocate for every flexibility that USDA can provide, both to the National School Lunch Program and after school and summer meal providers, as communities come together and try to make sure that all of their kids have the food that they need. So I really appreciate the opportunity to be a part of the webinar. Just as a reminder, these are the Feeding America food banks that have agencies that have distribute food in every county of the state. And in pre-COVID times, they were distributing about 125 million meals through 2,400 partner agencies and pantries. So right now, we are still strong. The food banks are still doing a great job responding, thanks to the increased food supplies that are coming from USDA. And we appreciate the support of the community and the National Guard and the governor and the Department of Agriculture, as we all work together to sort of get through this temporary, novel, unprecedented crisis that we're in. So thank you, Vanessa, and thanks everybody for the great presentation on food insecurity.
Thank you, Dana. I really appreciate what all you do with the Georgia Food Bank Association and your leadership with Feeding America, again, as well as the great statistical information and research done by Madison, Corrales, and Tampson. You know, we're all able to get through this together. We're a team, and just grateful for the partnerships that we have with the Department of Education and others. So thank you very much.
Thank you, Vanessa.